the Weight Medics programme help people to lose weight?
Well, at the core of our programme is a trained, experienced, qualified private doctor. They've studied for 5 or 7 years to gain the medical qualifications that earn them the right to run a patient's weight loss programme. We have GPs, consultants, people with a background in clinical research, and there's no doubt that patients really value confidential consultations with a private doctor as part of their weight loss programme. It really helps them to stick with it because next time they see the doctor, they want to make sure they've actually lost some weight.
What happens then in your first consultation?
Well, typically the first consultation takes about 15 or 20 minutes. The receptionist will welcome the patient, ask them to complete a record card with their contact details and their medical history, and then show them in to see the doctor. The doctor discusses their weight loss objectives, looks at their medical history in detail, and then checks their height, their weight, their blood pressure, and so on. And if they're a suitable case for treatment, they'll be given the most appropriate eating plan, they'll be given some medication to reduce their appetite, and a series of handouts that the doctor thinks are relevant to that particular patient. They then get shown back to reception where they take payment and they book in the next appointment. Follow-ups typically take 5 to 10 minutes, and depending on the amount of weight to be lost, we'd expect to see the patient for between 3 and 6 months.
And what sort of additional support do you provide your patients?
Well, there's a number of things we do in between their clinic appointments. We have a patient care team, and they will telephone the patient within a few days of their first appointment, see how they're getting on and answer any questions that weren't resolved in the initial session. And then they'll stay in touch with them throughout the programme to see how it's going and see if they need any additional help. We also give the patients a password to an area on our website where we've got videos, audio recordings and articles about weight loss and nutrition, and they can download those whenever they like to do that. We also run webinars from time to time so they can log in online from their home or office, and we'll cover a particular aspect of the weight loss programme, like managing your blood sugar, for example. And we produce a monthly newsletter called Good Living, which they can either pick up in the clinic or we can post it out to their home address.